I need more pumps.
Even for pandemic-hardened hospital staff, the newest arrival to this intensive care unit is tough to stomach.
Young people who get into this tragic situation, that's even more heartbreaking.
A woman in her mid-30s and pregnant. She tested positive for COVID-19 and had to be intubated. Doctors delivered her baby via C-section while she was unconscious. The baby survived, but the mother is now in a coma.
And we noticed that she's just not improving, and in fact, she's actually getting worse.
A lot to handle, especially for someone who has never done this job before. Dr. Cinziana Avranescu is an anesthetist who typically works in the hospital's operating room. But starting this week, she's being redeployed as a critical care nurse.
I feel that this is our chance to help.
This hospital, like many others, is grappling with a shortage of ICU nurses. As a result, every day, precious ICU beds sit empty.
And I said, if you need my help, if there's anything I can do to coordinate and help in this situation, let me know.
And this is the result.
Or that there are continuous infusions.
Within days, Avranescu and her colleagues organized a crash course to train dozens of doctors to become critical care nurses.
We have to stand together. It's a camaraderie thing. It basically is supporting each other and just kind of standing shoulder to shoulder to get through this awful wave.
Most here are surgeons and anesthetists who volunteered after Ontario cancelled non-emergency surgeries. They're used to working in the ICU and caring for the critically ill, but the differences between jobs are daunting.
We're going to be doing things that we're not necessarily super comfortable doing.
ICU nurses are typically tasked with caring for a single patient. They undertake years of schooling and months of specialized training to work in the ICU, now being condensed into a couple of days.
Doctors normally don't manage IV pumps or how to turn a patient safely or how to document as a nurse rather than document as a doctor. They're very different techniques.
They admit the move isn't without risk, but by training up to 40 new nurses, the hospital can double its ICU capacity to ensure every patient who needs a nurse receives one. Jeff Semple, Global News, Toronto.